Welcome to this first aid course. We will discuss how to perform basic life support, as well as various first aid procedures. This course is presented by Safe Train Consulting. Section 1. Emergency Scene Management. First aid is the aid that is given to an injured or sick patient on the scene, before more advanced help arrives. The first aider must make use of his own personal knowledge and logic, as well as his or her ability to improvise. People require first aid because of accidents, illness, and chemical contamination that leads to a loss of working hours and income. The total of injuries can be drastically reduced if everyone works in a safe manner and does not take chances, as well as if everyone makes sure he or she is skilled in first aid. Industrial accidents usually happen far away from medical facilities. Most injuries are minor, but even a minor injury can become infected if the workplace is dirty, and therefore lead to death. The immediate covering of these injuries will decrease this possibility. The careless handling or transportation of an injured person can cause more damage to the injury and cause more pain and suffering. First aid can fall into two main categories, namely, treatment in a life-threatening situation awaiting medical help. Treatment for minor injuries. There is a variety of first aid equipment available, and there are specific procedures to follow when dealing with people who are injured in the workplace. The purpose of this chapter is to describe and explain the different equipment to support the first aider, in line with specific procedures he or she must follow to comply with policies and legislation requirements. It is important to treat injuries, whether minor or serious, immediately, and where the accident occurred, through applying first aid methods. First aid can save limbs and lives. First aid training is readily available and only takes a little of your time. This course will teach you the correct way to render first aid to an injured person. The first aid recovery with sound first aid principles. Properly applied first aid methods can save lives and reduce recovery time. If the correct first aid methods are applied, then it can mean that there may be a difference, for example, between temporary disability and lifelong disability for the victim. First aiders should learn to recognize the signs and symptoms of injuries and sudden illness. The first aider is also likely to be trained in dealing with injuries such as cuts, grazes, or broken bones. They may be able to deal with the situation in its entirety, for example a small adhesive bandage on a paper cut, or may be required to maintain the condition of something like a broken bone until the next stage of definitive care, when an ambulance arrives. First aid principles. The first aid principles are as follows. To preserve life. Protect the unconscious casualty. Prevent the condition worsening. Promote recovery. Call for medical assistance. The first aider. The first aider must be aware of the standard of care he is able to provide, as this standard of care relates directly to the concept of negligence. If the correct standard of care was not provided, the individual will be judged according to hypothetical persons of similar training and experience. The first aider should work in a systematic manner to provide basic life support. Prevent the condition from becoming worse. Promote recovery. Alert the emergency services as necessary, for example the police, fire brigade, and/or ambulance. The role of the first aider. They should recognize an emergency, take charge and delegate, gather info and provide basic life support, alert the emergency services, support the patient, hand the patient over and report. Psychological barriers. Besides the safety aspects, there are psychological and physical barriers, which one may need to address before you can go ahead and assist. The problem may stem from within oneself, the emergency, or the victim. Consent. When a first aider goes to someone's aid, he undertakes to provide any assistance he can give safely, and to remain on the scene until the casualty can be handed over to medical assistance, or some other authority. The first aider is given certain protections under the law. Therefore, he should not be overly concerned about legal liability. Consent is divided into four categories. 1. Actual or expressed consent. The injured gives verbal consent that the first aider can continue with treatment. 2. Implied consent. When the injured cannot give consent, and a significant risk of death exists, the first aider can continue with treatment. 3. Minor's consent. The parent or guardian of the injured child gives consent, and the first aider renders assistance. When no parent or guardian is present, and the child is under the age of 12 years, the first aider renders assistance. When the child is older than 12 years, the rule for actual and implied consent applies. 4. Consent of the mentally ill. The same as for minors' consent. Statutory requirements. The Occupational Health and Safety Act 85 of 1993 requires the employer to bring about and maintain, as far as reasonably practicable, a workplace that is safe and without risk to the health of the workers. This means the employer must investigate the following: that the workplace is free of hazardous substances, such as benzene, chlorine, and microorganisms, articles, equipment, processes, etc., that may cause injury, damage, or disease. Where this is not possible, the employer must inform workers of these dangers and how to work safely, and provide personal protective equipment for a safe workplace. However, it is not the sole responsibility of the employer to adhere to the Occupational Health Safety Act, but the worker is also responsible that he or she adheres to the regulations within this legislation. In short, this means that the worker and the employer share responsibility regarding health and safety in the workplace. The Act, known as the Occupation Health and Safety Act 85 of 1993, consists of 50 sections approved by Parliament. The purpose of the Act is to provide for the health and safety of persons at work, or in connection with the use of plant and machinery. It also provides for the protection of persons, other than persons at work, from hazards arising out of or in connection with the activities at work. This means that, in terms of South African legislation, each employer must maintain a safe and healthy workplace which is free from all reasonable hazards. All factories must be kept clean and free of smells or leakages arising from drains and toilets or any other nuisance. In addition to a safe and healthy work environment, there should also be receptacles for waste. The aisles, roadways, and passages should be properly marked. The stockpiling of materials should be prohibited or carefully monitored. There should be proper storage space. Notices should be put up for staff. And color coding should be introduced in the factory. Legal aspects. The first aider must be aware of the level of treatment that he or she can provide. The level and standard of treatment relate directly to the concept of negligence. When the correct standard of care is not provided, the first aider will be judged according to a hypothetical person with similar training and experience in court. In other words, what would a reasonable man do? At no time should untrained personnel be allowed to administer first aid in an emergency, as this could seriously increase the severity of the injuries and result in unnecessary death. Get consent if conscious, and explain procedures, respecting that the patient's religion, culture, and/or if the patient is a minor. All first aid procedures must be recorded and reported accurately. Every patient has the right to confidentiality and privacy. Duty of care. Duty to care describes the legal duty owed by one person to another to act in a certain way. As a first aider, you have a duty of care towards your patients to exercise reasonable care and skill in providing first aid treatment. The duty arises because you have knowledge and skills relevant to a medical emergency situation. If you choose to provide first aid assistance, you have a duty to use your knowledge and skills in a responsible way. The common law does not impose an automatic duty on first aiders to go to the aid of every patient they come across. However, first aiders do have a duty to provide first aid assistance if they have voluntarily taken on that role. For example, a nominated first aid officer in a workplace owes a duty of care to assist another person in that workplace. Once you start first aid treatment of a patient, you do take on a duty of care to provide first aid with reasonable skill and care and ensure your actions do not increase the risk to the patient. You should continue to provide first aid once this treatment has begun, until the scene becomes unsafe. Another trained first aider or higher qualified medical help arrives and takes over. The patient shows signs of full recovery. You become physically unable to continue. The law in South Africa is very lenient towards first aiders, and it excludes from liability a person where, in an emergency, they help a person who is, or risked being injured. Such protection from civil liability for an act or omission exists as long as the person rendering assistance does so in good faith. That is, acting honestly, without fraud, collusion, or participation in any wrongdoing. The person's action was without expectation of reward or payment. The person was not responsible for the injury in relation to which the assistance was provided. The person's capacity to exercise reasonable care and skill was not significantly impaired by being under the influence of alcohol or drugs. The person exercises reasonable care and skill, and the person does not impersonate a healthcare or emergency services worker or a police officer or otherwise falsely represents that he or she has skills or expertise in connection with the rendering of emergency assistance. In addition, South Africa has legislation which provides protection for volunteers of charitable, religious, educational, and benevolent community organizations. Such volunteers are protected from civil liability for acts or omissions made or done in good faith within the scope of the activities organized by the community organization. The protection does not extend to damage caused by the volunteer's criminal conduct or impairment of the volunteer's ability by alcohol or drugs. Negligence. In the unlikely event that legal action is taken against a first aider, in connection with providing first aid assistance, the courts would look at the circumstances surrounding the event to see if the first aider acted in a negligent manner when the first aid was provided. The following factors must all be present for a first aider to be found negligent. A duty to care existed between the first aider and the patient. The first aider did not exercise reasonable care and skill in providing the first aid. Breached the relevant standard of care. And the patient sustained damage as a result of an act or omission of the first aider. A first aider is not considered a professional in most cases. A court would look at the first aider's training and at what a reasonable person would have done with the same level of training in the same circumstances. Because encouraging people to assist others is in the public interest, it is likely that the South African courts would only see first aiders as liable if it can be shown that their behavior was grossly negligent and would take account of all the circumstances of the event. The court may examine issues to establish whether the first aider exercised reasonable care, such as: what was the first aider's level of knowledge? What information was available for the first aider, including: was adequate questioning used? Was a thorough examination of the patient undertaken? Were all the facts available considered? Were accepted first aid procedures complied with? What were the circumstances in which the first aider helped? Example: a first aider gives CPR to a patient in cardiac arrest. During this CPR, a rib is broken. The resuscitation is successful, and after the event the patient decides to sue the first aid practitioner for the rib injury. The court would look at the facts and may decide that it is reasonable to expect that a first aider might break a patient's rib while delivering CPR to save the patient's life, and the first aider acted with reasonable care and skill, and the first aider was not negligent in providing CPR in this way, and the outcome for the patient of not performing CPR could have been far worse than suffering a broken rib. Recording. First aiders should always make notes or fill out patient report documentation when care is rendered, no matter how minor the emergency might be. Proper records will help you to recall the incident if you are ever asked about it at a later stage. The responsibility is greater if you have a role as a first aider in your workplace, and you may have reporting obligations under the occupational health and safety legislation. You can check this with your workplace occupational health and safety representative. Records may be used in a court, so ensure that your reports or notes are legible, accurate, and factual, contain all relevant information, and are based on observations, rather than opinions. When preparing a report, some general guidelines should be followed. Use ink only for any notes and remarks. Sign and date the record. Any corrections should be crossed out, with a single line and initialed. Do not use correction fluid to correct any mistakes. The information should be kept confidential, and should only be accessed by authorized people. In a workplace incident, a copy should go to authorized employer representatives for auditing and occupational health and safety monitoring purposes. Occupational Health and Safety Act, General Safety Regulation, Section 3. First aid, emergency equipment, and procedures. An employer shall take all reasonable steps that are necessary under the circumstances to ensure that persons at work receive prompt first aid treatment in the case of injury or emergency. Where more than 10 employees are employed at a workplace, the employer of such employees shall take steps to ensure that for every group of up to 50 employees at the workplace, or in the case of a shop or an office as contemplated in the Basic Conditions of Employment Act No. 3 of 1983, for every group of 100 employees, at least one person is readily available, during normal working hours, who is in possession of a valid certificate of competency in first aid. An employer shall at a workplace where high-risk substances, or toxic, corrosive or similar hazardous substances are used, handled, processed or manufactured, ensure that the first aid worker referred to in Sub-Regulation 4 is trained in the first aid procedures that are necessary for the treatment of injuries that may result from such activities, including the acute detrimental effects of exposure to such substances, and in the emergency procedures, which are necessary in the case of accidental leakage or dumping of such substances. An employer shall affix a prominent notice, or sign, in a conspicuous place at a workplace, indicating where the first aid box or boxes are kept, as well as the name of the person in charge of such first aid box or boxes. First aid kit. A list of items that are the minimum contents required in a first aid box or kit were published in terms of the Government Gazette, 14192 dated August 7, 1992. These are the only items to be kept in your first aid boxes. No medication is allowed in first aid kits in the workplace. These items are for emergency purposes only, and should be issued either by the departmental first aider, or the department head. Please note that a spillage kit had been added to the content of the first aid box. When one of the items has been used, ensure that the form is completed stating date and purpose of use, and ensure that it is replenished immediately. The basic principles of dressings. A dressing is used to cover a wound, to assist with control of further bleeding, and prevention of further contamination. There are 3 types of dressings that should be part of any first aid kit, namely adhesive, pressure and gauze dressings. As it comes in direct contact with the wound, it should be sterile, or as clean as possible. Absorbent, to soak up body fluids, such as blood or any discharge. Soft and compressible, so pressure can be distributed over the wound. Non-fluffy, so the material will not stick to the wound. No cotton wool. Bandages and slings. Different types of bandages. Sterility is not necessary, and can be used to secure a dressing. Gauze roller bandages are absorbent, breathable, and often elastic. Elastic bandages are used for sprains, and pressure bandages. Adhesive, elastic roller bandages are highly effective pressure bandages, or durable, waterproof bandaging. Triangular bandages are used as slings, tourniquets, to tie splints, and many other uses. The most used type of bandage is the gauze bandage. It is a simple woven strip of material, which can come in any number of widths and lengths. A gauze bandage can be used for any bandage application, and including holding a dressing in place. A triangular bandage is a piece of cloth cut into a right-angled triangle. This is felt by many trainers to be the most versatile of the bandages available, as it can be used fully unrolled as a sling, folded as a normal bandage, or for specialist bandages, such as on the head. Sometimes dressings and bandages are combined, in which case they must be sterile. Adhesive bandages, for example band-aids or sticking plasters, are of the most used items in a first aid kit. Straight adhesive bandages. Butterfly or knuckle bandages. The main types of bandages are triangular and roller bandages. They are used to secure the dressing, and assist in control of bleeding. Provide support to a limb or joint. Hold splints in place, and immobilize parts of the body. If a bandage is applied, it should cover the whole dressing, and do not remove once it is in place. If it becomes saturated with blood, apply another one on top, so that clotting that has already taken place will not be disturbed. There should always be a pulse, distal to the site of the bandage. Where possible, the nail beds must be kept uncovered, to enable detection of inadequate distal circulation. Should signs of inadequate distal circulation be visible, as observed from skin temperature and color, loosen the bandage, and reapply. Equipment. We have now explained the different types of bandages that are appropriate for the first aider, but this is not all. There is other equipment that you should know about in order to treat a casualty at your workplace. Firstly, you need to consider your safety and act of any danger in the surrounding area. If everything is safe, use first aid. If needed, get someone to call for an ambulance. First aid can be anything from dressing a small wound, controlling bleeding in larger wounds, or providing cardiopulmonary resuscitation, also known as CPR. We will discuss the CPR process. When the first aider uses the mouthpiece, he or she will then do CPR. Whenever a casualty occurs in the workplace, certain equipment should be used to assist the injured person. Equipment for casualties may include stretchers, spinal boards, blankets, splints, and thermometers. It is important to understand that the first aider is not a medical practitioner, or a paramedic, and therefore should not move any injured person. The first thing a first aider should do is to ask someone to contact the emergency medical services first. The first aider can support the emergency team once they arrive with especially important information, and must be written down. The emergency medical team may require information from you, and must therefore be prepared. Instruments: adhesive tape, hypoallergenic; trauma shears, for cutting clothing in general use; tweezers; irrigation syringe, for cleaning wounds; rubber suction bulb, for clearing the airway of an unconscious patient; disposable gloves. Disposable gloves should be provided in a first aid kit, and must always be worn. Torch. A torch is a useful addition to a first aid kit, especially one placed in a vehicle. Stretcher. Stretchers are support beds, which are durable, stain, and water-resistant vinyl-coated nylon fabric, which is easy to clean. Black handle grips for secure lifting. This stretcher is ideal for any first aid room. Stretchers are available in single and double fold models. It has a reusable lightweight aluminum pole feature, with 2 heavy-duty tubular aluminum poles, with 2 cross-spreader bars. Splints. The splint must fit the shape of the injured arm or leg properly to provide the best possible support to the injured person. Sometimes, it may be necessary to replace a splint, as swelling decreases, and the splint gets too big. Repeatedly as a fracture heals, a splint may be applied again, to allow easy removal for therapy. A SAM splint is a versatile splint made of malleable aluminum covered with foam. Air splints are easy to apply, can also help control bleeding, but bulkier and more expensive. Wire ladder splint. Spinal board. The full polyethylene spinal backboard is designed for the safe immobilization of victims by emergency responders. The spinal board is a one-piece shape, constructed from high-density polyethylene. It is durable, impact, and weather-resistant. There are several handles and holes for easy lifting and application of straps. Blankets. This multi-purpose first aid blanket is ideal for stretchers and beds. The blanket keeps the victim warm, whether at the scene of an accident or in a first aid room. A space blanket is a lightweight plastic foil blanket, sometimes called an emergency blanket. Thermometer. The thermometer is a device that measures temperature. A thermometer has 2 important elements. They are the temperature sensor, for example, the bulb on a mercury thermometer, in which some physical change occurs with temperature, and converting this physical change into a value, for example, the scale on a mercury thermometer. Other equipment. Eye cup or small plastic cup. Instant-acting chemical cold packs. Sterile eye wash, commonly saline. Sterile saline may also be used for cleaning wounds, where clean tap water is not available. Swabs that are sterile non-woven. Hand sanitizer or antiseptic hand wipes. A pen light. Alcohol pads should not be used on open cuts or wounds, since they cause tissue damage and delay healing. They can be used to prep unbroken skin for injections, etc. Or to disinfect equipment such as thermometers. While not a medical use, alcohol pads are also useful as a solvent to remove ink, adhesives, etc. Antiseptic ointment or spray. Calamine lotion. Aloe vera gel, used for a wide variety of skin problems, including burns, sunburns, itching, and dry skin. Burn gel, a water-based gel that acts as a cooling agent, and often includes an antiseptic such as tea tree oil. Epinephrine auto-injector, known by its brand name the EpiPen. Often included in kits for wilderness use, and in places like summer camps, to treat anaphylactic shock. Requires a prescription, and can be used with minimal training. Poison treatments. Activated charcoal, to be used when directed by poison control. Under no circumstances are you allowed to hand out any form of pills. Leave this for the medical practitioner. You do not know the person's medical background, and if you supply the injured person with tablets, and the person is allergic to the tablets, you will be held liable. Improvised uses. Many first aid items can have improvised uses in a survival situation. For example, alcohol pads and petroleum jelly-based ointments can be used as a fire-starting aid in an emergency, and the latter can even be used as an improvised lubricant for certain mechanical devices, and adhesive tapes and bandages can be used for repairs. These alternate uses can be an important consideration when picking items for a kit that may be used in wilderness or survival situations. Temporary substitutes for first aid equipment include: for hand protection, plastic bags can be used. For wound dressings, clean cloth, handkerchiefs, sanitary pads, disposable nappies, napkins, and towels can be used. For cervical stabilization, rolled towels or sandbags on both sides of the neck can be used. For bandages, strips of material, socks, ties, scarves, and shoelaces can be used. For supporting material, pillows, blankets, towels, and clothing can be used. For splints, carton box, mesh wire, and wooden planks well padded can be used. To improvise, slings, ties, ropes, belts, and scarves can be used. Universal precautions. Universal precautions refer to the practice of avoiding contact with patients' bodily fluids by means of the wearing of non-porous articles such as gloves, goggles, and face shields. Universal precautions are called so because they must be taken by every person, and pertain to all body fluids, as it is not possible to know who has HIV, or any other diseases carried in body fluids, especially in blood. Follow these steps when dealing with injuries and wounds. Every organization must have a first aid kit as laid down by legislation. No one should have direct contact with another person's blood or body fluids. Use gloves, plastic shopping bags. Stop the bleeding as quickly as possible. Apply pressure directly over the area, with the nearest available cloth or towel. Clean wounds. Use antiseptic, and keep all wounds, sores, grazes, or any broken skin always covered. Manage accidental exposure to another person's blood or exposure during injury by cleaning skin with running or clean water and then cleaning it with antiseptic or diluted household bleach. Clean contaminated surfaces and materials. Surfaces, floors, etc. must be cleaned with diluted bleach. Bloody bandages and cloths should be sealed in a plastic bag and burnt, instruments and equipment washed, soaked in bleach, and dried. Disposal of sanitary towels and tampons. All female staff and learners must be informed about proper arrangements for disposal of these items so that no other person has contact with them. Medical instruments, especially scalpels and hypodermic needles, should be handled carefully and disposed of properly in a sharps container. Additional precautionary methods. Hand washing with soap and water. Wherever possible, use gloves or something similar to protect your hands. Wash hands, even after using gloves. Be particularly careful about washing your hands where you have not used gloves, or some other form of protection. Diluted bleach, or mentholated spirits can be used in addition to soap and water. If hands are dried with a reusable towel, it should be washed regularly. Gloves. Gloves should be worn during all procedures involving blood or other potentially infected body fluids. Gloves are not necessary, however, when the amount of blood is small enough to be contained in a swab, for example, in the case of an injection site. If gloves are in short supply, priority should be given to procedures involving contact with blood. Gloves should be discarded after each use on a single individual. Heavy-duty gloves should be worn when sharp objects and potentially contaminated materials are taken for disposal. Hands should be routinely washed with soap and water after removing gloves, in case of tiny tears in the material. Protective clothing or equipment. Protective clothing, such as waterproof gowns, aprons, masks, and eye shields, need to be worn where there is likely to be exposure to large amounts of blood. Protective equipment, such as CPR masks, need to be used when resuscitating people who have stopped breathing. Safe handling of sharps. It is through accidentally puncturing the skin with a sharp implement, such as a needle or scalpel, that you are most likely to expose yourself to HIV infection in emergency settings. All sharp objects should be handled extremely carefully. They should never be passed directly from one person to another, and their use should be kept to a minimum. You should never try to bend or break needles, nor attempt to recap needles in their sheaths, as this is often associated with accidental puncturing of the skin. When needles are responsible for such injuries, they are often referred to as needle stick injuries. Puncture-resistant containers for the disposal of sharps must be made readily available, and should be kept close at hand. Sharps should always be kept out of reach of children. Sharps should never be thrown into ordinary waste bins or bags. Disposal of waste materials. People, including small children, often scavenge in rubbish dumps, so the safe disposal of waste materials and sharps is vitally important. All contaminated items are regarded as medical waste. Medical waste is disposed of in dedicated medical waste containers. Containers must be clearly marked. Use red bin liners. Separate medical waste from municipal waste. Do not overfill the bins. Do not tamper with the contents. Always wear PPE when handling medical waste. Medical waste containers have to be removed by companies dealing with or handling medical waste bins. Close the bin liners properly to avoid leakage or secondary contamination. Do not burn waste bins. Medical waste only. Cleaning and disinfecting of equipment. Cleaning of medical instruments between patients is essential. Special attention must be paid to equipment that is contaminated with body fluids. HIV can be killed through boiling, or the use of chemical disinfectants. Non-reusable equipment, such as disposable needles and syringes, should not be reused. Reusable equipment should first be dismantled, and cleaned and then boiled for at least 20 minutes. For those instruments that are heat sensitive, the following agents may be used. Chlorine-based agents, for example, household bleach, 2% glutaraldehyde, or 70% ethyl and isopropyl alcohol. Protective clothing may include, but is not limited to, barrier gowns, gloves, eyewear including goggles or glasses, face shields, hairnets, shoe coverings. As a first aider, you will use personal protective devices when you treat a casualty. For the purpose of this learner guide, we will discuss mouthpieces and surgical gloves. Sterile mouthpieces for first aiders. There are various mouthpieces on the market, but first aiders must use mouthpieces that are sterile to protect themselves when rendering first aid. HIV can be transmitted by blood, blood products, semen, vaginal secretions, and possibly other bodily fluids containing visible blood. A first aider can be infected with different diseases, and is therefore crucial to use disposable mouthpieces. A first aid CPR pocket mask. A first aid CPR pocket mask comes in a plastic case. Protect yourself when administering CPR, and avoid painful actual mouth-to-mouth situations. Ask your employer to provide you with the equipment that will assist you when you must do CPR. You never know on who you might have to perform mouth-to-mouth resuscitation. There are certain procedures you should follow when doing CPR with your mouthpiece. Cardiopulmonary resuscitation, known as CPR, is a procedure to support and maintain breathing and circulation for a person who has stopped breathing, known as respiratory arrest, and or whose heart has stopped, known as cardiac arrest. The pocket mask is a small device that can be carried on one's person. Air is administered to the patient when the emergency responder exhales through a one-way filter valve. Surgical gloves. It is important for first aiders to use sterilized hand gloves when touching the injured person because it eliminates the risk of getting infected, especially when there are fluids present, such as blood, vomit, etc. The basic principles of hygiene. Use a clean pair of gloves per patient to prevent cross-contamination. Work as cleanly as possible, as permitted under circumstances. Do not let dressings or gloves lie around and contaminate an emergency scene. Wash your hands immediately after rendering first aid.
I'm now going to demonstrate to you how to put your gloves on and how to remove them. First of all, put our gloves nicely on. Don't touch on the inside. Also, there our gloves are on. Now to remove them safely, pinch the one glove in the middle of the palm of the hand and remove him safely. Place it nicely in the other glove. Put your one finger underneath and you can throw them away. If you want to be very nice, you can tie it off. And discard into your little waistband.
The 4 safety S's. Safety for yourself. Safety of the situation. Safety of the area. Safety of the patient. Emergency rules. The following rules are not negotiable. Safety. Yourself, the patient, and the environment. Stay calm. Do not move the patient, unless his life is in immediate danger. Do not leave the patient alone unnecessary. Do not give anything to eat, drink, or smoke. Assessing the scene. Stand still. Is it safe? Follow the emergency rules. Think. What happened? Sources of information and help. Classification of emergencies. Medical. The problem is within the body and is associated with illness. Trauma. The problem arises from outside the body and is usually associated with injuries. The mechanism of injury will determine the manpower and equipment, for example, jaws of life, needed to deal with the emergency. Information. Information will be primarily obtained from the patient. Other sources are bystanders, friends, or family. It can be based on physical evidence on the scene by using your senses, for example, smell, hear, feel, see, and taste, especially if the patient cannot cooperate, for example, age or is unconscious. Safety. It is most important to survey the scene for any possible danger, and to correct life-threatening situations. This must be done in a speedy, calm, and systematic manner, as hazards can take different forms, for example. Safety for yourself. Ensure that you have the necessary protective equipment with you, for example, gloves, life aid, etc. Safety of the patient. Only move the patient if his or her life is in danger. Safety of the situation. And safety of the area. Ensure that circumstances are safe by removing hazards and potential dangers or by evacuating the scene of the emergency. Priorities in an emergency. In all emergencies, the first aider must do the following. Ensure the safety of themselves and any other bystanders and the casualty. Assess and examine the situation promptly. Ask someone to call for help. Closely monitor the casualty for changes in condition. Examine the nature of the casualties. The following actions are compelled to examine the nature of the casualty. Record observations on a piece of paper. If you send someone for help, have him carry a piece of paper that states the following. Victim or victim's location. The nature of the emergency. The number of people needing help. The condition of the victim. What is being done to treat the victim? And any specific environmental conditions or physical obstacles. The human brain requires a constant supply of oxygen to work efficiently. A person who has stopped breathing will start to suffer irreversible brain damage within 4 to 6 minutes. It is therefore important to get help as soon as possible. Calling an ambulance. When calling for help, the phone first approach is recommended in life-threatening situations. This allows for a quicker response time for the ambulance, and it is particularly important for casualties suffering from a serious injury or condition such as a cardiac arrest. Outcomes for these casualties are significantly improved the quicker advanced life support treatment is given. It is important to note where there is more than one casualty. The care of an unconscious casualty has priority. Calling for help is easy. Any person can call for an ambulance in an emergency. The ambulance operator is trained in receiving emergency calls and providing instructions over the phone if you are unsure what to do. What to say to the emergency medical services? The person who phones the emergency medical services will be asked if an ambulance, fire, or police is requested. The person who phones will be switched through to the requested service. The emergency operator for the ambulance, fire, or police will then ask for information on the following. The suburb. The address of the incident or casualty. The nearest cross street. The nature of the emergency, for example a car accident, chest pain, etc., and how many people are involved. The casualty's condition. Is the casualty conscious or unconscious? If the casualty is breathing. Your name and the phone number you are calling from. Do not hang up until instructed to do so by the emergency operator, and keep the phone line free in case there is a need for the operator to call you back. Do not stop treatment until the ambulance arrives, or instructed by the ambulance officers or paramedics. This allows the ambulance officers or paramedics time to quickly prepare their equipment and get ready to take over treatment. In rural locations, where single ambulance officers may respond, you may be asked to remain and assist the officer until further backup arrives. In these situations, follow carefully any directions given. The emergency call. Call for help. If somebody arrives to assist you, ask him or her the following. Do you understand Afrikaans or English? Do you know anything about first aid? Please phone the emergency services on 10177, or 112 or 107. As soon as you get through to the EMS, state your name and the telephone number from where you are calling. Then supply the reason for calling, i.e., CPR, choking, etc. Supply exact address, including suburb with landmarks, and nearest crossroads. Report any complication of location, i.e., quote gate number in larger factories, etc. Find out and record operator's name, and ask the operator to repeat the address, so you know that he knows where to send the ambulance. Never replace the receiver of the telephone first, always wait for the operator to end off, as this will ensure the rapid response and arrival of the ambulance. Do you understand? What is the number? Are you able to make the call? Come back to me and report. Please hurry. If nobody arrives to assist you, you must carry out the above procedures by yourself. The emergency service could be contacted on the following numbers. Remember, the patient should never be left alone. When the ambulance arrives, the first aider informs the person in charge what has been done. Give his name and address if it is required, and only then leave the scene of the accident.